Welcome to this explainer. When we typically evaluate national health systems, our minds almost immediately jump to state-of-the-art hospitals, cutting-edge medical technology, and those massive centralized budgets. But if we take a closer look at the systemic success of Thailand's healthcare, we uncover a profoundly different reality. The true architecture behind their incredibly robust health outcomes doesn't just sit in those large medical centers. It's actually anchored in a highly organized, community-led system known as primary healthcare, or PHC. So today, we're going to rigorously deconstruct the Amorn way, the brilliant strategic framework that literally transformed local communities into the very foundation of public health.
Okay, let's dive into this. Our syllabus for today covers 4 main pillars. First, medicine versus public health. Second, the Amorn way framework. Third, critical health literacy explained. And fourth, scaling to global goals.
Starting off with Section 1, Medicine versus Public Health, Foundational Divergences.
To truly appreciate the mechanics of Thailand's primary healthcare model, we absolutely have to separate 2 concepts that often get conflated in everyday conversation. Clinical medicine is, by its very nature, individualized and reactive. It focuses on the diagnosis and the curative treatment of a single person who is already unwell, trying to bring them back to baseline. Public health, on the other hand, operates on a much broader, macro scale. It looks at entire populations and communities, and its primary focus is proactive, preventing illness from occurring in the first place and promoting systemic health across the board.
And this brilliantly illustrates the exact conceptual difference we are talking about. Think of this quote: "Medicine is pulling a drowning person from a well, public health is building a fence around it." Both disciplines obviously share the ultimate goal of saving lives and ensuring longevity. But the method of intervention? It's entirely different. Thailand's primary healthcare system is essentially the architectural blueprint for building that preventative fence. Instead of waiting for people to fall into the well of severe illness, it mobilizes resources to intercept the danger long before a hospital bed is ever needed.
Moving right along to Section 2, the Amorn way framework, structural shifts.
Let's see how this builds upon that foundational concept of public health. Dr. Amorn Nontasut, who was a true visionary in Thai public health, recognized a massive structural flaw in traditional bureaucratic systems. The old issue-based approach created these strict, rigid silos. Imagine having one team running maternal health campaigns, a totally different one fighting dengue fever, and yet another addressing mental health. It created immense institutional redundancy, wasted a ton of resources, and, quite frankly, just confused the local populations. Dr. Amorn flipped this entirely on its head, moving to an activity-based integration. He consolidated all those scattered efforts into 2 primary community activities: lifespan health management, so caring for people from childhood right through to old age, and environmental management. It completely streamlined operations and maximized efficiency.
To actually implement this on the ground, Dr. Amorn's approach utilized what we can view as common tasks. Instead of issuing these rigid, top-down instruction manuals from the capital, the administration actually observed what was already working out there in highly successful local communities. They extracted those foundational, effective tasks and basically created an open-source template for primary healthcare. It acts as a highly flexible guide. Local administrators don't have to reinvent the wheel or waste time on trial and error. They can just take this proven framework, adapt it to their specific regional nuances, and deploy it immediately. It is, without a doubt, a masterclass in scalable public administration.
That brings us to Section 3, Critical Health Literacy Explained, Societal Impact. We need to define this core term carefully, because it represents a profound evolutionary leap in societal capability. When we casually hear the phrase health literacy, we usually just think of basic knowledge, right? Like knowing what a balanced diet is or understanding the benefits of cardio. But critical health literacy goes significantly deeper than that. It is the capacity of a community to actually analyze health data themselves, to intelligently question the systems that govern them, and to mobilize social movements to actively shape public policy. It elevates the community from being mere subjects of health policies to acting as active analysts and advocates.
So the crucial point here is that this level of literacy completely redefines the role of the everyday citizen. They transition from being passive patients just waiting around for care into true policy co-creators. Because they actually understand the data, these empowered communities can successfully demand systemic changes that directly impact their well-being. They can effectively lobby for essential public goods, like the creation of green spaces or the strict enforcement of pollution management. They literally become the architects of their own healthy environments. For you and me, the takeaway is realizing that health isn't just what happens inside a doctor's office. It's what happens right outside our doors, in our neighborhoods.
Finally, Section 4, Scaling to Global Goals, the Macro Impact.
The amazing thing is that the local, community-level actions we just analyzed map directly onto massive international academic frameworks. If we look at universal health coverage, or UHC, the true engine making it financially and operationally viable is a robust primary healthcare system. By intercepting health issues at the community level, PHC drastically reduces the patient burden on major hospitals. You aren't just waiting for acute illness to strike and overwhelm the system. Furthermore, this localized health security serves as the definitive grassroots foundation for achieving the United Nations Sustainable Development Goal 3, which aims to ensure healthy lives and promote well-being for absolutely everyone.
Now, what's really interesting about this is that it highlights a pretty harsh reality regarding international policy. Global health success is mathematically impossible if we rely solely on top-down mandates. Sustainable development goals cannot simply be legislated into existence from a boardroom in Geneva or New York. Universal health coverage will financially collapse under its own weight without that proactive community interception of illness we talked about. Ultimately, the entire macro structure of global health is entirely dependent on the micro-strength of empowered grassroots community volunteers. And that brings us to a critical crossroad. Thailand's Amorn Way proves definitively that building a fence around the well requires the hands of the community. But as our world shifts, as rapid urbanization changes the very fabric of our neighborhoods, and as digital health technologies sometimes distance us from actual human connection, we face a profound systemic challenge. How do we sustain this vital community volunteer spirit in an increasingly fast-paced digital era? Are we replacing human infrastructure with technological infrastructure at our own peril? It is a complex question that health policymakers worldwide must urgently answer. Thank you so much for joining me for this explainer. Keep questioning, keep analyzing, and I'll see you next time.